What is the human cytomegalovirus? Human cytomegalovirus is also known as CMV. CMV is a part of the herpes family of viruses. It is called the human herpes virus 5, or HHV5 for short. It is a common infection that is usually harmless. However, once CMV is in a person's body, it stays there for life. Transmission of the human cytomegalovirus. CMV is a sexually transmitted disease and is spread by close contact with a person who has the virus in his or her saliva, urine, or other body fluids. It can also be transmitted from pregnant women to her fetus during pregnancy. It can also be spread through the transplant of organs and blood transfusions. Young children often shed or pass the virus for months after they first become infected. Although parents of children who are shedding the virus can become infected from the children, CMV does not spread easily. Prevention of CMV. There are a few simple steps that you can take to avoid exposure to saliva and urine that might contain CMV. Number 1. Wash your hands often with soap and water for 15 to 20 seconds, especially after changing a child's diaper, feeding a young child, wiping a young child's nose or drool, and handling children's toys. Number 2. Do not share food, drinks, or eating utensils. Number 3. Do not put a child's pacifier in your mouth. Number 4. Do not share toothbrushes. Number 5. Avoid contact with saliva when kissing a child. Number 6. Clean toys, countertops, and other surfaces that come into contact with the child's urine or saliva. Treatment of CMV. Healthy people who are infected with CMV but who have no symptoms usually do not require medical treatment. There is no drug license to treat congenital CMV infections. There are limited data on the use of antiviral medications in infants with symptomatic congenital CMV infections with central nervous system involvement. Pediatricians and other specialists play an important role in making sure that children with congenital CMV infections are assessed and treated as needed. Currently, there are no vaccines for preventing congenital CMV disease. However, a few CMV vaccines are being tested in humans that contain only pieces of the virus. Symptoms of CMV. Most healthy children and adults infected with CMV have no symptoms and may not even know that they have been infected. Others may develop a mild illness when they get infected and have the following symptoms: fever, sore throat, fatigue, and swollen glands. The only problem is that these symptoms are also symptoms of other illnesses, so most people do not realize that they have been infected with CMV. Statistics of CMV. Among every 100 adults in the United States, 50 to 80 are infected with CMV by the time that they are 40 years old. Additional facts about CMV. The incubation period for CMV infections transmitted by contact is unknown. However, clinical manifestations occur 3 to 12 weeks after an infectious blood transfusion and between 1 to 4 months after an infecting tissue transplant. CMV is not a concern for most of the general public. It is only a problem when it affects patients with weakened immune systems, such as those who have advanced HIV and organ and bone marrow transplant. It is also a problem during pregnancy because the mother can pass it to her child.